Are you struggling with clinical management? Maybe you're finding it difficult to manage your patient within 12 minutes for the RCA. This is a common problem that many registrars struggle with. In this video, I have a chat with Dr. Hannafil, a GP registrar who passed the RCA with flying colors while working less than full time, despite having a diagnosis of dyslexia. I have no doubt that the insights that Dr. Hannah shares in this video is going to help you to boost your score in clinical management. Clinical management is a part where you're impacting the life of your patient. So many trainees actually procrastinate and they rush through their clinical management. What would you say about things that you've learned to make sure that you have a good clinical management, Hannah?
So I think a big, and again, a point I think you picked up in our one-to-one was that I was putting the examination within the clinical management, and exactly as you say, I was stalling because I felt comfortable asking questions and finding the story. As soon as I tacked the exam in with the data gathering, that already saved me some time in clinical management. But I actually did spend a lot of time going through each topic area and sort of looking at the CKS guidelines. And I mentioned these crib sheets. I had sort of, for headaches, I'd have like the main causes of headaches and what the management would be. And to be honest, a lot of these with the body systems, it's very similar things. You watch and wait, there's lifestyle advice or things the patient can do themselves, or there are investigations you can organise, or there are referrals that you can ask for other people. So I sort of had that structure for my management. And another point was early on, I realised I wasn't actually committing to a diagnosis. It's a very scary thing to do, especially when I'd always been under my trainee banner. But actually, I think that made a huge difference when I sort of try and say with confidence, I think this is what's going on. It might be this or this, but if it's this, these are the options. What do you think? And I think what I'm trying to say is the main things that you can do, the patient can do things, you might be able to do things, does this, that, and then other people might be able to do things. So allied health professionals, specialists at the hospital. And it's actually the consultation, all of them are, you get a lot of duplicates, I think.
That's very good. Yeah, I think it's very important to actually be able to do that. And one of the things that you talk about is to be interested with your patient and know about the context. How do you integrate that in your management?
I think, so an example would be my acute case. It was an elderly lady with hypoglycemia going into hospital. And with that, we were able to discuss the risks of her coming to the surgery, just to see if we could check her over, see if there was any source of infection or something we could manage, because of the COVID risks as well of going up to the hospital. It was very helpful that her daughter she was with her daughter, so was able to then involve her daughter into that. I think it's just almost trying to think outside the box, and a bit like I said, just putting yourself in that person's shoes. So, okay, I'm an elderly person. There's this COVID pandemic going on. I'm not too fussed about my high blood sugar, but the doctor's telling me to go into hospital. Is there another option? I think it's really just, again, trying to think what you would do or what you would advise if that was your grandma, or if that was like a really good friend asking you for advice or something, or if it was you, what would you do or think about?
So thinking from a patient's perspective, making the consultation more patient-centered, that helps you in your clinical management. If you found this video useful and you'd like to watch the whole interview, then click the video here. Take care everybody, bye bye.